Hi, I'm Dave Wurzol, and you're watching PHTV4 Living Well. And on Living Well, we look at a variety of topics related to a healthy lifestyle. Today we're going to talk about dental care. And with me to look at this topic and a specific problem, in this case, bad breath, maybe we'll touch on stained teeth as well. I've got Dr. Brian Gambla from Gambla Dental in Palos Heights. Dr. Gambla, thank you for being here.
Thank you.
How long have you been a dentist in Palos Heights? How long have you been a dentist?
I've been a dentist for 33 years. I practiced in Oak Lawn for 22 years, and then 11 years in Palos Heights.
Well, thank you for bringing your expertise. I mean, that's a lot of background there. So
you're welcome.
Good. So I'm probably going to say the word wrong. Correct me. Halitosis?
Halitosis.
Halitosis?
Yes.
So we're talking about, let's talk about bad breath first and maybe stained teeth later. What causes halitosis? And then maybe we can talk about the risks with it.
Sure. Halitosis is really just what we consider bad breath. It can be caused by a lot of different factors. Some can be postnasal drip. Some can be lack of good dental hygiene. That will couple with periodontal disease, but a lot of it is just not maintaining good dental health.
So my immediate thought is, and I imagine a lot of people go through this, well, I'm aware I've got bad breath, I'll just chew some gum, or I'll rinse my mouth real quick. But that may not be addressing something way more serious going on.
Those are very, very temporary solutions. I mean, probably 30-second solutions. You feel better for the moment, but it's really not addressing what the underlying problem is. The underlying problem typically is making sure that you're brushing, flossing, seeing the dentist regularly to keep things clean. A lot of times you can use a tongue scraper to clean some of the bacteria off the tongue, and that can also create bad breath. It's called sulfur or sulfur dioxide. There's compounds on the teeth that basically give you what would be bad breath.
And you mentioned earlier, I'm thinking about like if I've sinus infection or I've got allergies and a lot of postnasal drip or whatever the thing is, that can impact this as well. Right?
Absolutely. That's a big problem a lot of times because you go to bed at night, you lay your head back, and the congestion drains and it hits the back of the tongue, breaks down into sulfur, and that's what gives it that bad scent.
So again, this is a great example of something where chewing gum is not addressing the sinus thing going on. So I guess that would be my question. At what point do we say that, no, now I need to see the dentist because it's not going away, or even maybe brushing my teeth and doing what should be good dental care isn't enough at home?
Well, a lot of times patients do try to solve things on their own, which is great to a point, but at one point you do need to see dentists to get teeth cleaned and the whole oral cavity cleaned more thoroughly. And once you do that, they get better instruction with maintaining good dental health. Chances are a lot of the residual things like bad breath will diminish.
So in the immediate, let's say I see the dentist and it gets addressed and it's being treated the way it needs to. I mean, could it get serious enough that there are other consequences or other health risks with this?
Yes. Fundamentally...
You're going to scare us all now.
No. Fundamentally, there's a lot of things that can happen. You can be treated for bad breath and things like that, but a lot of times there's underlying issues, like you may be brushing but not flossing. You may not have had a cleaning in a long time. You need a more aggressive cleaning, something to take all the plaque and tartar off the teeth, because that does break down into a noxious odor, basically.
Okay. All right, so if I have a bad breath problem in the immediate, see a dentist, get a deeper cleaning,
Yes.
And then I'm assuming the next part of it would be long-term means regular dental and better daily tooth maintenance?
Yes, and I think a tongue scraper is really an important part of this because it really does pull all the bacteria off the tongue. So if you're doing good dental hygiene and then you are scraping the tongue to make sure that everything's cleaned off of there. So if you do have postnasal drip, that will help out. But you can use a rinse as well. A lot of these rinses have a basis of chlorine dioxide, and what that will do is kind of break down some of that sulfur.
Now, is that part of like a fluoride rinse, or are we talking about something different now?
Completely different.
Okay.
Completely different. Closest is a great brand that has chlorine dioxide in it.
Okay.
When you talk periodontal disease, there's other things like Listerine that will work well, but it still will help a little bit with the halitosis.
Okay. So a fluoride rinse is a good thing to be using, but may not have the stuff in it I need for this.
Exactly. It may not target what you need for bad breath.
Okay. All right. And then we mentioned in the beginning, like stained teeth, you know, and endless commercials on TV about whitening your teeth. But first, is stained teeth, is there a health risk in that beyond like, I just want whiter teeth, you know?
It's always nice to have clean teeth and brighter teeth because psychologically you feel better. But the whole thing is you don't want things that adhere to your teeth because that's what causes cavities. So the cleaner the teeth are, the better it is. But from a psychological standpoint, if you have white teeth, I think you feel better all the way around.
Right. There's a confidence thing. Probably.
Absolutely.
So the one risk with stained teeth might mean, well, I've got things sticking to my teeth now that...
They're adhering. That's exactly it.
And that can lead to something else then at that point. Is that the part
Yes.
we're talking about? Okay.
Yes.
All right. All right. So we got another rinse we want to take a look at. What brand or where do we get that rinse? What
Over the counter at a
Okay.
Walgreens or CVS, you know, your local pharmacy.
Okay. And what was it called? You said
It's chlorine dioxide, but its closest is a great one for
Okay.
bad breath.
Okay. All right. Dr. Gamble, thank you very much. Again,
You're
as usual,
welcome.
very helpful, and we appreciate the advice on how to address some of these things and also take care of them at the dentist's office if we need to.
Sure.
Thank you. I'm Dave Wurzel, and you've been watching PHTV 4 Living Well. We've been talking with Dr. Brian Gamble, dentist at Gamble Dental in Palos Heights, about dealing with bad breath and stained teeth. Thank you for watching.